So I thought we'd start with introductions. Who are you hearing from today? Sephora, please take it away.
Hello, everyone. My name is Sephora. I am a PhD candidate at the University of Waterloo, and I work with Dr. Heather Keller in the Nutrition and Aging Lab. I'm also a registered dietitian working in long-term care with experience in community, and my research is around food and menu planning within long-term care.
And I am Sarah. Some of you may have seen me from the Research Connects webinar. I'm the strategic lead research here at the Alzheimer's Society of BC. I've been engaged in gerontological research for the past 18 years and actually completed my doctorate with Sephora supervisor, Professor Heather Keller at University of Waterloo. We had a brief overlap in Heather's lab, and so I'm so pleased to have the opportunity to present with her today. Um, Prior to taking on this role at the Society, I was actually completing a postdoctorate fellowship at UBC, where my research focus was on Chinese family caregiving at mealtimes for residents living with dementia. And so this topic is near and dear to my heart. So I'll just start with an overview for today's presentation. We're going to be talking about diversity in long-term care homes in Canada, the importance of food and meal times for ethno-racial groups, factors that contribute to poor food intake and malnutrition, the outcomes of that malnutrition in relation to nutrition, aging, and health, um, and the importance of providing cultural foods in long-term care, and then some key takeaways at multiple levels when we're thinking about how do we create a culturally inclusive meal times for residents in long-term care. So before we dig in, I just want to take a moment to clarify some key terms that we'll be using today. And I'm going to be paraphrasing these definitions that have been provided by the Canadian Institute for Health Information. We understand race as a social construct that categorizes people based on perceived differences in physical appearance. There is no scientific basis for discrete racial groups. Racial differences are used to create and maintain power differentials within social hierarchies. Okay, so that's the first term. The next term that I want to explore is ethnicity. When we use the term ethnicity, we are referring to a multidimensional concept that refers to shared cultural membership based on characteristics like language, geographic origin, nationality, religion, traditions, ancestry, and migration history, and sociodemographic factors. So you'll hear Sephora and I use the term ethno-racial groups throughout our presentation today. And this term is used to refer to a community of people who share both ethnic and racial characteristics to highlight their unique experiences. And so it's sort of the intersection of these two things coming together. And this is particularly important when we think about long-term care because it's congregate living, right? We're living all together and we're trying to find a balance between caring for the many while also attending to individual person's preferences and needs. So just a quick overview, a snapshot of long-term care in Canada. So long-term care is defined as 24-hour professional nursing supervision for people who have complex care needs. Now, almost 70% of residents living in long-term care are living with dementia, and the majority of whom are sort of in their mid to late stages in their dementia journeys. I also want to give you some numbers so that you can appreciate the important role that long-term care has in supporting our older Canadian population. So based on figures from the Canadian Institutes for Health Information, in 2021, there were 2,067 long-term care homes across Canada. In Ontario, they had the highest number at 627 homes, and in BC, it's about half that number, about 308. Now, Canada's older adult population is growing, and it's also becoming more culturally diverse, with approximately one-third of people aged 75 and older being born outside of Canada. Now, this has important implications for the long-term care sector, as services and care practices need to be tailored to meet the needs and preferences of these diverse ethno-racial groups. Now, a big problem that we face currently is that this sector does not collect the data that we need in order to understand the needs of these diverse groups. So Canada has yet to establish systematic infrastructures for collecting race-based data on groups living with dementia. although there are several jurisdictions that have taken it upon themselves to try and fill those gaps. But it really is crucial that we have race-based data because we know that dementia risk can vary across different ethno-racial groups. In 2024, the Alzheimer's Society of Canada published its second report called The Many Faces of Dementia in Canada. And this report is linked in the helpful resources document. And so Michael will just throw that into the chat so you can have a read through it later if you'd like to take a closer look. But this study used simulated models that combine data from the 2016 Stats Can census and other findings from the research literature to provide an informed estimation of the impact of dementia in Canada over the next 30 years. Now, based on this modeling that was created by study experts, research groups, and statisticians, it was found that by 2050, 1 in every 4 people who develop dementia will be of Asian ancestry. And this is a really diverse group. We're talking about people with ethnic origins, including Chinese, Indian, Filipino, Vietnamese, Lebanese, Pakistani, Iranian, Korean, Sri Lankan, Japanese, and more. So you can just imagine the differences in cultural variation. This is not a homogenous group. It is so diverse. And so if we think about the impact of knowing what lies ahead for us. We need to think about the implications of this, and we need to be paying attention to how the long-term care sector responds to this diversity in residents that they'll be serving over the next several decades. So why is food and meal times so important in this conversation? And I'm going to take a nutritional anthropological approach to this question. So we know that meals are ritualistic. They're patterned, and they indicate how a culture socially constructs its hierarchy and its relationships. It serves as a function of normalcy, right? It's a temporal marker for residents. Breakfast in the morning, lunch in the afternoon, dinner in the evening. It's also a major social focal point for people living with dementia in long-term care, as this may be the most important part of their day to interact meaningfully with others who they're living with. And so in this sense, eating together really is the social fabric of a long-term care home. Because food and food rituals are ways that we reinforce our identities, a resident's familiarity with food and food rituals plays into their nutritional status, right? How much they want to eat. It plays into their well-being, and it is a huge factor in their quality of life. You can imagine for an older immigrant, familiar foods may be especially linked to their sense of self, to their cultural identity, to social practices and religious beliefs. We know that food preparation and consumption are resilient aspects of migrant culture. Food rituals serve as a bond that connects them to their country of origin. So when an older immigrant resident living with dementia is served food that they do not recognize, nor do they desire to eat, this has a really serious implication on how much they're going to eat and thus their risk factor for malnutrition. So in broad strokes, malnutrition occurs when a resident lacks the necessary nutrients or has an imbalance of nutrients needed to maintain their overall health. Now, malnutrition has been found in approximately 44 to 61% of Canadian residents in long-term care. And the main reasons for this are due to challenges related to food intake, meaning, they might have oral health issues or challenges around feeding oneself, which is quite common towards the end of a dementia journey. And that can mean that they're not eating enough. But there also are instances where malnutrition is a result of an acute or chronic disease. Now, malnutrition is serious and has negative effects on health, well-being, and quality of life for residents. And such impacts of being malnourished can include and result in poor wound healing, increased falls, and then decline in physical functioning, compromised immunity, which can then lead to hospitalization and in some cases mortality. And so then you can appreciate the impetus for family caregiving to be involved in a resident's care, especially at mealtimes. So there's this misconception that, ethno-racial communities keep their older family members at home. We know that the transition from home to long-term care is often met with unique barriers for these particular groups, and that can result in a delay in their long-term care home placement. For immigrant families, this transition into long-term care can be particularly stressful. They're often forced to compromise their own cultural values and norms with those that are typically associated with Anglo-centric or Western long-term care homes. Once they're settled into a long-term care home, an ethno-racial minority resident may experience language barriers, unfamiliar, decor and design, foreign care approaches, and unfamiliar food and mealtime rituals. And this can result in feelings of isolation, which can then lead to poor food intake. And that can trigger family caregiving uh, to increase in order to support with, translation, interpretation, and food provision. When I was conducting my postdoctoral research, much of what I observed confirmed what I had read in the limited amount of research that's been published on this topic. And that's why I'm so excited that Sephora is doing this work, because we need more research on this. And I observed a lot of family members spending additional money and a ton of time preparing home cooked meals, sometimes 3 times a day for residents. And they would bring this food and they would plate it so carefully and they would provide eating assistance and company to the family member living with dementia. And so, even though their older family member was in a formal care setting, these families continue to provide an inordinate amount of caregiving because they were just so scared that their loved one might decline faster without their involvement. So now I'm going to pass the baton over to Zafura to get into the diet, nutrition, and the importance of providing cultural foods in long-term care.
Perfect. I will start off by defining some terms. So, diet is the quality and the quantity of foods we eat, and nutrition is more than just about what foods and drinks we eat. This is also about how we process it in our bodies and how we break down the food and use it as fuel in the body. So, good nutrition is essential for cell and tissue repair, and as well as when we live our daily lives and activities that we participate in. And it's important to keep ourselves well. And as we age, our dietary and nutrition needs change. Being aware of these changes and adjusting your eating habits will support your health and quality of life. And before I get into more about specifics of nutrition itself, I wanted to discuss a couple of terms. First being frailty. So I know Sarah already talked about malnutrition, and dehydration is when we're not getting enough fluids. Um, and both malnutrition and dehydration can actually increase our risk for frailty. And frailty is not, it can come with aging, but it's not a normal part of aging. And it can be reversed, but it is a condition of reduced function and health in older adults. And some of the features of frailty include unintentional weight loss, so weight loss that you did not mean to happen, and fatigue, low energy and exhaustion, loss of strength, and slow walking speed. And frailty can actually increase our chances of going into the hospital. Or for many adults who are living in the community, it can actually increase risk of actually going into long-term care itself. And sarcopenia is another side of the coin. It is characterized by involuntary loss of lean muscle mass and function that occurs with aging. It is a significant contributing factor in the development of frailty in older adults. And for both of these conditions, frailty and sarcopenia, malnutrition does play a huge role in its development and vice versa. So if people end up becoming more frail and losing muscle, they might also, it might impact their ability to eat well, prepare foods for themselves, shop for themselves. And so in fact, it can lead to malnutrition, or if you're not eating well and your food is not good quality, then it can also lead to malnutrition. So, and as well as frailty and sarcopenia. So it's all kind of interconnected. So these are some basics of eating well. We want nutritious foods, and it is the foundation for healthy eating. So this includes vegetables, fruits, whole grains, proteins, these should be consumed regularly. And foods with mostly unsaturated fat should replace foods that contain mostly saturated fats. By unsaturated fats, I mean anything that is more plant-based, like olive oil, etc. And water should be the beverage of choice. And we should typically limit processed or prepared foods and beverages with a lot of sodium, free sugars, or saturated fats. But the number one thing I would like to tell people is to eat in moderation, because sometimes you want to eat the foods that are filled with sugar. Sometimes you want to have the food that has a lot of sodium in it, and that's totally fine. I don't want anyone to restrict their diet just because something's labeled as bad. I want people, because the thing with food is that it's not only about maintaining your physical health, but it's also an important aspect of your social health and psychological health. So sometimes you enjoy certain foods and you should have those in moderation for sure. Make sure you also include these other foods as well. That's what I'm trying to say. So I wanted to bring the Brain Health Food Guide. So um, this is a food guide that was created, and it is essentially the do's and don'ts of eating if you want to maintain a good brain health and cognitive function as you're aging. So, and this is also included in the resources guide that is posted in the chat. So this goes through a little bit more of the specifics of what type of foods you should be eating and some of the foods that you should be limiting if you want um, to promote brain health. So you have to include a variety of foods that in moderation. And by variety, I mean trying different types of foods, trying, having a good number of different foods, because different foods have different type of nutrients in it, and having a diverse pattern of eating will make sure that you're meeting your needs in terms of your different nutrients that are required, and focusing on healthy eating and not one specific superfood. I know right now in social media, we see a lot of different messaging around what type of foods are like in to eat and what type of supplements are the ones to go after. But no, don't fall for that. Those things are just temporary. Fads will come and go, but as long as you are eating something that you're enjoying, and it is, you're having your fruits and vegetables, you're having your whole grains, you're having your protein, then, stick to those things. Um, and eating until you're comfortably full and not stuffed. So this means that while you're eating, making sure that you are paying attention to your body and and if you feel like you're getting there a little bit full, then maybe slowing down, enjoying the process and making sure that you're not overeating, having a different types of fruits and vegetables, including berries, leafy greens, um, and choosing foods with healthy fats such as olive oil daily, and choosing fish, beans, nuts, and several times a week, but limiting red and processed meats, limiting foods high in added sugar, uh, and as well as sodium, and choosing dairy products such as milk and yogurt that are low in fat, and selecting whole grains over refined grains. For example, choosing something that's multigrain instead of white. And this brain health food guide was created so that everyone can kind of follow along. It's kind of a roadmap on how you can eat to promote brain health. So this next section comes from my doctoral work. So these were findings from my first study, where I actually surveyed food service managers and dietitians around Ontario, to see what are some of the challenges and the facilitators to planning a culturally diverse menu or a culturally inclusive menu for residents in long-term care. And these are some of the challenges that were highlighted within the survey. So one being too few residents from diverse cultures. And my survey was pretty good geographically in Ontario, where I targeted rural as well as urban homes. So in the rural homes, we found that there were too few residents from diverse cultures, because these homes in rural areas, they might have a predominantly um, uh, like white group of people, but then they have just a few people from different diverse cultures, and these homes didn't particularly know how to accommodate for these few residents. And then there was also lack of skills with cultural recipes. So this was in connection to cooks in long-term care homes. They didn't know how to do certain um, cooking techniques, or didn't know how to make certain recipes from different dishes. Increased expenses for culturally unique ingredients. I know all of you all are going out and shopping grocery stores, and we're already seeing how inflation is um, affecting the way we purchase our food products. And that's the same for long-term care homes. Um, we get a certain amount of m- money for that's allocated towards the food budget, and we have to be very strict on how we're spending that money. And sometimes some of these cultural ingredients tend to be more expensive than and especially if you're trying to buy it in bulk, it can add up. And then there's lack of time to prepare cultural dishes for some of the homes. So a lot of the times there are shortages with the amount of staff that are on for the day, including cooks. And sometimes they might have to prepare several recipes at the same time. So sometimes the cultural dishes take much longer. Maybe they contain more steps to preparing those dishes. So it takes a lot longer to cook. And for some homes, there were too many different cultures to accommodate. And these were in homes that were more so near Toronto, where there were a lot more different types of cultures that were represented within the home. So um, the food service managers and dietitians, they didn't know how they could please everyone within the budget that they had, within the staff, the number of staff that they had. So it was challenging in that sense. So I wanted to bring your attention to this term, cultural humility. When it comes to caring for people from different cultures, typically people talk about cultural competence, which is uh, gaining knowledge about a certain culture. But cultural humility actually takes it a step forward. And I tell people to focus on cultural humility rather than competence, because reality is that we don't know everything about every person's culture, and it's impossible. But cultural humility is the process of being aware of how people's culture can impact their health behaviors, and in turn, using this awareness to cultivate sensitive approaches to providing care. So, there are three pillars for cultural humility. The first one being curiosity. So, this is curiosity is the process of how you go about learning about people's culture. That could include asking questions, um, in a respectful manner, and making sure that you're having conversations with the resident or with family members about what their culture means to them, what are the different components of their culture and how it relates back to their food and their nutrition, as well as other care practices within long-term care. Because the chances are someone's culture, it goes beyond just food, it goes into other care practices within long-term care, whether it be how they are looking at when in the process of passing away, or like some cultural traditions that are part of that. So making sure, and a big part of curiosity is also looking at yourself as a person and understanding, okay, what are some biases that I might hold against certain cultures, certain groups of people, maybe unlearning them, educating ourselves, and really understanding like how you can be there to support the resident and family members. Consultation is going um, like consulting with members, whether it be the resident family members or as well as community organization and community members, and understanding what supports there are that you can use to provide culturally inclusive care to residents. And then the third one being commitment. This is really important. And on every level, we need commitment from um, the home, from the institutions, and as well as the management in the homes to have an ongoing commitment that they are going to try their best to meet people's needs, especially when it comes to their culture. So these are some facilitators to providing cultural foods that I found through my studies. So number one being opportunities for resident feedback. Resident feedback was seen as one of the most important methods of understanding what their residents wanted. So this included resident satisfaction questionnaires. This included informal discussions with their residents. So a lot of the times, care providers would just walk within the long-term care in the dining room, and they would stop by and ask residents questions, and or the residents would come up and tell them about their likes and dislikes. So that these type of opportunities, as well as resident council meetings, these were really good opportunities for care providers to understand what their uh, residents wanted, what they were happy with, what they didn't like. Individualized menus was the second um, uh, component that really helped in providing cultural foods. So individualized menus are sometimes when you have a few people from a specific cultural group, you are able to actually um, food service managers and dietitians are able to actually plan out an individualized menu that would work well for them as opposed to the menu that's already provided within the home. And this is tailored more to their needs, has specific foods that the resident really enjoys, and this is, created in consultation with the resident and family members. Um, the third one was incorporation of cultural days. This was particularly important, not just for the residents themselves, but as well as the residents, not only for the residents from specific cultural groups, but also for all the residents, because what this did was actually not only fill that gap where it provided different types of foods for the culturally diverse residents, but it also provided an opportunity for other residents to experience new foods and cuisines. And they found it actually more, it was their opportunity to try new foods for the first time. And actually, a lot of the food service managers and dietitians said that they were able to actually include some of the recipes from these days into their actual menu as well because residents enjoyed them so much. Fourth thing was family support and advocacy. So family, and as Sarah mentioned earlier in her slides, family was seen as integral to keeping that connection with culture because a lot of the times family did fill in that support to bring in foods from home for their parents, for their family members. And they were the ones who usually would join, you know, would come to care conferences and really discuss what their parents or what their family members wanted and really truly advocated. So, and also dietitians and food service managers also found it really helpful that, having that representation within family council and, resident food councils, they were really the ones that would advocate for what everyone wanted. And yeah. And one more thing to add, in terms of opportunities of feedback, I also found that a lot of the participants stated that even though they used resident satisfaction questionnaires and family satisfaction questionnaires, those questionnaires typically did not include questions on cultural preferences. So, which is an important thing to keep in mind if you're using these methods to collect satisfaction, um, the level of satisfaction, you should also include questions on cultural preferences because that component might be missed altogether. So these are some key takeaways that we organized in different levels. So overall, on the overarching system level, we need the number one thing that we need is a standardized approach for collecting race and ethnicity data. As Sarah mentioned before, this is a huge gap. And this is particularly important because people like us who do research, like me, we need this data to understand what is happening on the ground. So this data can help us analyze whether needs are being met within long-term care when it comes to different components of care, including the way we provide food within homes. So having a good and standardized process of collecting data. This data is particularly important because it does impact the way we can do research and collect information. And then increasing funding to research, making sure that there is money allocated towards uh, um, being able to do research for different groups of individuals, because ultimately research is what informs our care practices within homes and within our healthcare system. So if we are able to do research, then we can also come up with best practices for populations so that we can make sure that they have a good quality of care and a good quality of life. Ultimately, that's our goal, right? And then there's the long-term care and community level takeaways. So having long-term care home buy-in and commitment, making sure that long-term care homes and management understand that this is an important topic and this is something that is the need of the hour and something we need to focus on, because ultimately we can try to make a lot of changes within the home, but none of those changes will stick unless the home and the long-term care sector is committed to that change. Staff education and training. There were a lot of through my thesis work, I found that there was a lot of gap between staff education and training, whether it be um, related to skills or whether it be also related to their own perceived notions of caring for people from different cultural groups. So making sure that they understand why this area, or working within this area and getting education within this area and providing care to people from different cultural groups is important, is key. And also partnerships with community organizations uh, with with any type of care. I believe it's very important that we consult and we work with other organizations who can maybe bridge that gap in that might exist, that is keeping people from providing the best quality of care. So making sure that we have that um, relationship with different organizations is important. For example, there are in Northern Ontario, there are hospitals and long-term care homes that uh, created partnerships with um, organizations that provide game meat for uh, Indigenous populations. That way, it's filling in that gap of providing cultural foods for that population. So we can kind of take that as an example and apply it to different organ other facilities and organizations. So relying on community organizations or working with them can be very beneficial. And these key takeaways are from the long-term area level, a long-term home area, long-term care home level. Sorry. So
Sorry.
in
I don't like to use like care unit or anything, so I use home area, and that can be a little bit confusing. So I should have given you a heads up.
Oh
So
no, it's all good. It's just me not being able to talk.
you're good,
So,
Sabrina.
okay, so incorporating, celebrating different cultures using food. So, yeah, if homes are able to, they should, um, they should try incorporating different cultures within any activities that they do within the home. I know that a lot of recreational staff, they try to celebrate different types of holidays and different types of uh, cultural days. So using food and incorporating different types of cuisines can also make um, make it better for introducing new foods to residents. That could be a way to um, make practices more culturally inclusive, um, and making sure that we are obtaining resident satisfaction information, but doing it well. So making sure that we're regular, making sure that we're doing it in a way where we're actually capturing all the information, including questions on cultural preferences, including discussions around culture is important, especially if you're also just walking around and talking to residents. So it is important that we are able to do that well. And lastly, ongoing advocacy from staff and family members. A lot of the residents, they can't speak up for themselves. So it is the job of staff and family members, especially to come in and fill that gap in. As a lot of care providers within the home, they get to know their residents pretty well, and many of the times they know exactly what the resident wants and needs, and they are able to um, work with other care providers and really advocate for the resident and family members too. They know what their family member likes and dislikes. And again, this might be changing for a lot of the persons who are living with dementia, because I know I have residents who like a certain food one day, but then after a few weeks, that changes completely. So making sure that there is that ongoing, advocacy, and also, um, you know, connection with the resident, so that we are able to just capture that information and change care practices as we go along. It is an iterative process. Anything you want to add, Sarah?
Yeah, just that I know that especially for like ethno-racial groups, speaking up in long-term care homes can be um intimidating because you're worried that saying something is going to compromise the quality of care of your family member. Um, and I would just like to say that there are, you know, that wouldn't happen, that I encourage families to in constructive ways to come up with ideas that might work, because really, homes are trying to problem solve, like they're just problem solving all day long. And so bringing it up in a constructive and positive way to increase inclusiveness, um, and to increase cultural competency, humility, and safety is something that I think is now going to be a standard expectation. Residents are entitled to eat foods that are relevant to them. And so there are a lot of programs that are being offered. I know that there is in the helpful resources document that was handed out, the CLRI, which is sort of like a center for excellence that exists in Ontario, has produced like a diversity inclusive toolkit for long-term care homes to use. And really they started like reflecting on like, where's your organization at? Like, what do you have in place? Taking the temperature as a starting point for them to go down that journey. Because I think it is, we talk about culture change in long-term care, moving from, sorry, the sunlight streaming in, talking about, moving from biomedical ways of caring to more person-centered and relationship-centered ways of caring. That includes uh, language and policies and guidelines that support and promote diversity inclusion. So I just want to sort of validate that, um, for those who are joining us today who have relatives in long-term care, um, that that should be an expectation, and you're entitled to ask for that. Yeah, that's our long reference list. And yeah, we just want to thank you for listening, for joining us today. We can get into some questions, but just to invite, if you have more questions for Sephora, her email is here, sephora.syed@uwaterloo.ca. And you can find me, research at alzheimerbc.org. Always happy to hear from folks. One participant noted, that there's uh, you know, stigma around dementia, around cognitive impairment can vary depending on ethno-racial group. And so I want to acknowledge that. And it can be really challenging when discrimination and racism can come um, between residents. Like that's a challenging thing to have to deal with within a home, but acknowledging that it does exist and it's a problem. Yeah.
Sarah, I saw a question earlier. It
Yeah.
might be a little hard to reach, but I had it written down here.
Thanks,
One
Michael.
person had asked, do the elderly absorb nutrients slash supplements as well as younger adults?
Um,
Laura.
Yeah. So it depends. It depends on the individual. There might be some changes that occur with people's digestive system. There might be issues around the way uh, like if people have, say, any type of GI related issues, just as such as Crohn's or IBS or anything like that, that might affect your different parts of your digestive tract. And the way we absorb nutrients is through our digestive tract. So if, say, you had surgery or if you're eating medications, if there's, any of those factors can actually impact how well you can absorb nutrients. So it's on an individual basis. I know vitamin D is something that we can absorb from the sun, but as we age, our capacity to absorb it through our skin becomes lower. That's why, older adults who live, especially in Canada, where we don't get sun majority of the times of the year, plus on top of that, the integrity of our skin, that can all impact our ability to absorb that vitamin. That's why usually uh, I always tell people go to your family doctor and always consult what vitamins you might be lacking in. And if you cannot meet those through food, you should definitely look at supplementation.
Oh, sorry, Michael.
Mm.
I just wanted to invite Sephora just to expand on something. Just as a dietitian who works in long-term care, Sephora, can you speak to the steps that dietitians take in terms of reviewing resident files and ensuring that they are getting adequate nutrition?
Yes. So what we typically do is, as a dietitian, we have assessments that we do. And for residents, it's either quarterly or yearly. So every 3 months we assess a resident, and every once a year we do a whole assessment as well. But yeah, we basically assess them multiple times a year, to see, and we look at different factors. So we look at their how much they're eating and drinking, looking at their medications, looking at other aspects such as their skin, looking at their bowel health, and we basically gather all this data up, and then we like to look at them holistically to see, well, how well are they doing in from a nutritional standpoint. We also look at things like, do they have how's their oral health, how are they able to, and how's their physical health, are they able to feed themselves, are they able to, how is their swallowing? Are they able to swallow foods and fluids well? Are there any issues related to any other factors that might impact the way they take in their nutrition? So we look at all of these things, and if we identify any issues, then we do an intervention. So we do some sort of we call it a nutritional diagnosis if there's a problem, and then we come up with a care plan to address that problem to make sure that we we are able to maintain their quality of life and their care. And also in long-term care, something I would like to stress is that it goes beyond just their physical, like biomedical care, as Sarah mentioned. We also keep in mind their social health and their psychological health, and making sure that whatever changes we're making, we talk to the residents and we plan with the residents and family members. It's not just something that I just you know come up with and just put it on them. I work collaboratively with residents and family members to come up with a game plan on addressing any issues, and if they're comfortable with it, if they're happy with it, we give it a go. And then as a dietitian, I typically follow up after I've made any change, every either in 1 week or 2 weeks, to see how it's going. If they don't like the change, we tinker about until we find um, what works the best, essentially.
Thanks, Sephora. And Michael, you wanted to flag something for us?
There's just two new short questions from Elizabeth. The answer might not be short though. Just curious, how diverse is the staff in the LTC homes? Ratio between staff and resident?
So right now we're starting to see a lot more diversity within the staff in long-term care homes. And typically the staff in long-term care homes tend to be female identifying, majority of them immigrant populations themselves. And we see, yeah, so it is part of the thing is that it is a caring profession and it's predominantly female, and it is made up of people from different diverse groups and typically immigrants. And at least that's the landscape in Ontario. I'm not unsure of what it might be like in BC. Or maybe Sarah, you might know, but that's what I see in Ontario. And in terms of the ratio between staff and resident, we want there to be a good ratio, like one staff per two residents. But again, there is a shortage in PSW staffing as well as RN and RPN staffing. So we sometimes it might even go higher than that.
Yeah, I think it depends on between provinces, and some provinces have like ratio requirements and others don't. Or those ratios might differ. So it just
Mm,
depends on what province you're in. I've seen ratios as low as one staff to six residents and a lot higher from that in others. So yeah,
mhm,
there is unfortunately variation.
yeah. I see another question. Can dementia affect an individual's tolerance towards food textures? For example, opting for more softer foods. So persons living with dementia, it can come with physical changes to people their swallowing as well. So there might be issues that come where there's delayed swallowing, and there might be structural issues as well. So I do find that a lot of people end up having either texture modification or fluid consistency modification. So it's a case by case basis though, like not everyone might have it, but there is um, a high proportion of people who do end up having some sort of changes, especially if they're on the later stages.
Yeah, it's correct me if I'm wrong, Sephora, but I think it's sort of like a combination of, what can they swallow, what is safe to swallow without, aspiration. So that's why Sephora mentioned like modifying the texture. So you might have a pureed or a minced food, or you might thicken fluids to make it easier for people to swallow. But it all just might be a texture preference. So all of a sudden, certain textures are just not appealing to them. Yeah.
And also there could be there might not be any issues, but there might be issues around um like how awake they are during meal times, or whether they're lethargic, and so there are a lot of factors that go into it, and we want to make sure that we promote or we have the safest options for them.
I just want to go back up. Lori made a really good comment around um, families, like if they're not a part of a family council, but wanting to bring forward some issues, approaching the family council to give that feedback to, say, director of care or food services director anonymously might be a good, safe way to do that. So thanks for flagging that, Lori. That's a really great way of approaching that. Just seeing a comment around fresh fruit smoothies. That's wonderful. That sounds delicious.
I know.
And another question for you, Sephora, around have you met any residents who sneeze during meal times? Does this have to do with food texture or swallowing?
um I do see people sneezing, but I do not know whether it has to do with texture or swallowing. Sometimes, like, it just happens. It might not necessarily be related to any anything to do with texture. Typically, what I see if someone is like not doing well with swallowing is that they are either like coughing a lot, or they're like choking, like it sounds like their voice is like gurgly, like as though there's like wetness inside their throat. And sometimes it also sounds like I can see after they've swallowed, like the food still remains in their mouth. So there are those type of kind of like physical things that I do see, especially as I am assessing for swallowing in long-term care. Um, but I will keep an eye out on sneezing.
That's interesting. Yeah, thank you for
Yeah.
flagging it. Yeah, well, if nobody has any other questions, as I said, Sephora and I are always happy to hear from people. And if you have questions that come to mind later, please feel free to reach out to us. We're always happy to elaborate or expand on anything that piqued your interest during the presentation. If you have any questions related to dementia, anything at all that you have on your mind, please give the dementia helpline a call. I believe it's available in English, Punjabi, Mandarin, and Cantonese. Thank you so much for joining us today. It was great to have you. We hope you enjoyed it. We hope you learned something or at least validated an experience that you've had. And we'll see you next time.